Well, Twitter has been increasingly used to have all kinds of conversations. This became especially true during COVID when people were turning to Twitter to see what was going on regarding the pandemic. That's why we became interested in this project, because we wanted to see in the world of OBGYN, how were we using it to share information, and who was sharing this information, as well as the misinformation that can be accessible to patients. So we were able to extract information using a software called Signals, which basically collects data on medical hashtags. So one of the things we looked at was, in the field of OBGYN, who are the different users using hashtags, and who are the more prominent influencers, like who is actually having an influence on the field, who's tweeting the most, who's being most active in these conversations. So one of the things we found is, depending on the different categories, we can actually see certain categories have more of a physician prominence versus patient influence in conversations. So I think that was also really interesting. I think this research is important because, as I mentioned, patients now have access through social media to this information that's being published more and more. And unfortunately, while there is a lot of information, there's also misinformation. So I think as physicians, it's very important to understand how social media is being used, what kind of information is available, to be able to work with our patients better and know where they're coming from and be able to adapt to their needs based on whatever they might have seen or how their opinions may have been influenced by things they've seen on social media.